If you're applying for medicine this year, you might want to have a look at this topic, which is about assisted dying and euthanasia. This is a critical topic. This is an important topic because of what's happening right now in the UK. As you know, the assisted dying bill is currently working its way through Parliament, and it has huge implications on medical practice in the UK, and it will certainly affect you as a future doctor. So in this video, we'll be looking at the UK's legal position currently and what's potentially changing. What are the ethical arguments around this issue? We'll look at it from different perspectives and perhaps some model ways of how you might want to approach and answer this topic should it come up in your medical interviews. Now, it's important to make a clear distinction on what assisted dying means, because often I come across people who confuse the two between assisted dying and euthanasia. To put it simply, assisted dying is where there is support from healthcare profession. However, that final decision to end your life, it happens as a consequence of what the patient does. So the patient decides on that final step how they will end their life. It is very important to understand what assisted dying means and how you would contrast that with euthanasia. I come across people kind of using the two terms synonymously, and I think it's important to clarify the subtle difference between the two. In both processes, by definition, there is involvement and support from the healthcare profession. However, when it comes to assisted dying, the final act of ending one's life is done by the patient. Contrast that with euthanasia, the final step is done by the healthcare professional. So I hope you can make that distinction and understand the difference. So when we look at assisted dying, you also need to make sure you're not confusing it with things like end-of-life care. End-of-life care is a common practice in the UK, and that is where we look at people in their last stages of life and we make things as comfortable as possible. And that can range from the care, the nutrition, even the mattress they're lying on, medications like pain relief, help with breathing medication, agitation and so forth. So it's about keeping people comfortable. So that is end-of-life care. It's very different to assisted dying. Let me point out how things are in the UK legally as of today, the 11th of November 2025. If you see this video post today's date, then make sure you are up to date on the current UK legal position. As of today, in England and Wales, assisted suicide is illegal under the Suicide Act of 1961. The Crown Prosecution Service decides on a case-by-case basis should anybody fall foul of that Suicide Act of 1961. At this moment in time, what you'll find is doctors in the UK can be involved in end-of-life care, i.e. supportive care of patients towards the end of their life. However, we are not allowed to be involved in assisted dying at this moment in time. However, this is what's being looked at in the Houses of Parliament and is liable to change in the near future. What happened in June 2025 is that the Houses of Parliament passed the Terminally Ill Adults End-of-Life Bill. What that means is that there is consideration to work towards assisted dying becoming law. However, this is yet to go to the House of Lords and pass. So as things stand at the moment, it is not yet law. But what might it mean? This is what we will look at. What might it mean when it becomes law? In Scotland, the bill is now at stage 1. And as of May 2025, it is progressing through their Houses of Parliament. In Scotland, the assisted dying bill is currently working its way through their Parliament and is at stage 1 of the reading process. So it is at a slightly different place at the moment. In the Isle of Man, the bill was passed in March 2025 and is currently awaiting royal assent before it becomes law. So you can see Isle of Man is slightly ahead of the curve. In Jersey, the draft for the assisted dying bill was lodged in September 2025. So they are slightly behind the curve. So it is important to be aware of where the bill is in different areas of the UK. So what does the assisted dying bill propose? So let's look at the English version, the Westminster bill, and let's break it down. So in a nutshell, the bill looks at assisted dying, i.e. if somebody has a terminal illness and is in the last 6 months of their life, there may be provisions for the patient to request assistance to end their life. But this requires a few bullet points, a few important pillars to look at. And I'll tell you what they are. There is something about doctors involved must be resident in the UK, such as doctors like GPs and consultants, meeting all the professional requirements as per the GMC. There has to be 2 doctors involved in the process in terms of assessing diagnosis, prognosis, capacity of the patient, and their voluntariness, i.e. not under due pressure from carers, family, and also the healthcare professionals. There is also something about the voluntary assisted dying commissioner's involvement, who will probably be a senior judge, and also an assisted dying reviews panel that will be made of legal background people, psychiatrists, social workers, and of course your doctors. Decisions cannot be made in haste, so the bill makes provision for a reflection period, i.e. over a 2-week time. The review panel and everybody involved thinks about the case and makes decisions in an unhurried manner with careful consideration. There will be a ban on advertising on this issue, so as it is not subject to marketing, i.e. dying services or somewhere where you can go and end your life. So it will not be allowed to be commercialized. So if this comes up in your interviews, you need to think about context, i.e. what is the current UK situation? Where is the bill at the moment? What is being thought of, i.e. the framework around terminal illness, around capacity, around panels and monitoring? You need to think about stakeholders here, i.e. patients and their families. You need to think about doctors and their teams. You need to think about society at large. Ethically, you need to think about autonomy here, i.e. the patient making their decisions without any undue pressure from anybody. You need to make sure that we are observing the principles of beneficence versus non-maleficence. Perhaps there is an element of justice to think about here, i.e. equity across the population, safeguarding measures, and also lack of coercion, and against coercion if you like. We need to think about safeguarding measures here in this issue, i.e. the involvement of panels, the involvement of judges, the legal profession, independent assessments, capacity checks, cooling off periods like I mentioned, overseeing bodies, and make sure we explain everything clearly here so that we're not necessarily siding on either side of the fence, but we're able to think comprehensively without showing any bias as such. Common pitfalls you might want to avoid is of course confusion over definitions, i.e. like I said, euthanasia different to assisted dying, different to end-of-life care. You don't want to sound one-sided here. You really need to be able to think about it from different perspectives, and also make sure you are up to date. This is a rapidly changing scenario. Make sure you are up to date at that time when your interview is happening. Thank you.